Welcome back to Diamond Words Podcast, where we're bringing you information and educational data on what's good for you and probably what's not. Today's episode is the Ozempic phase, more specifically that buccal region, buccal fat removal. Now, why is a sunken face so trendy now? We see many celebrities and social media feeds with a sunken, deep contoured look to the face. Now, sometimes this is a gaunt look, and it really depends on the individual's face whether they can pull it off or not. Social media feeds doesn't really quite grasp what the individuals look like in real life, because social media feeds have filters, and filters makes everything look appealing, and sometimes this is what fuels the trending faces we are seeing. So that being said, what is buccal fat removal? Well, there's fat pads all around the face, and my famous analogy is the continental drift. When Pangea, Earth, first started, all the continents were connected, and over millions of years, they're separated. So that's a continental drift, and that's what happens in our face. As the fat pockets in the face are connected together when we're very young, as we grow older, those fat pockets separate, leaving sunken regions that are characteristically not unique, but the same in everyone's face. And so buccal fat removal is taking one of those fat pads, which is right here, and yanking that fat pad out. This is a surgical procedure, should not and usually is not done within the office. It can be, but it should never be done in an office or office medical setting. When this fat gets taken out, we lose the fluffiness or the pillowness of the face. Once we lose that, as you are young, it may look great. Let's say 25, 28, it looks good. However, as time rolls forward, you're gonna have more of a gaunt and sunken cheek. And with this, you're going to look strange, you're gonna look different, you're gonna look hollow, you're going to look older. So basically speaking, do not remove fat from the face. There's so many other alternative options that we can do to make that appearance look strikingly beautiful. Let's talk about Ozempic. This is a product, an FDA approved product for weight loss. This can be used for individuals with weight gain issues or individuals with type 2 diabetes, in that it uses a glucagon-like type 1 hormone. And what that does, it stops the food from moving out of the stomach too fast, which means we feel full most of the time. So when we're taking that, it's injections. When you're on that, you don't feel as hungry after a few bites. And so you're reducing the amount you're eating, but you're also working out and probably eating healthier, and therefore you're going to lose a lot of weight really fast. This is a phenomenon that's occurring, and this medicine, this drug, Ozempic, seems to be better in terms of reducing the amount of side effects such as nausea, constipation, headaches, and so forth that comes along with these medications. If you are obese or if you have weight gain issues, and it's very, very difficult for you to remove those weight gain issues, and you do need the help of Ozempic, then you may start to notice some hollowness in the face because you're losing volume in the face. The problem occurs when fat is removed suddenly or too rapid. The face changes drastically. But if you drop too much weight, all it takes is ounces in the face for your face to be gone. For example, I had a patient yesterday. Sunken eye socket, sunken cheek region. Very flat, very droopy. And she told me that she had some products done a year ago. The products went away and made her face look like that. However, she failed to tell me that she lost 60 to 70 pounds within the span of about 3 to 4 months. That's rapid weight loss. And now she is 40 plus, but she looks 60 plus. And you can imagine the devastation of this person crying to me about the way she looks, because this fat was removed very suddenly and very fast. So sometimes what happens is, when we're in the gym also, we can have a great look working out. But what happens from the neck down and the neck up are two completely different things. The more weight you lose from the neck down, the better the body looks. However, the more weight you lose, the body looks good, but the face starts to age. And this is why marathon runners, cyclists, most of the time, they have older faces. You cannot burn too much fat in the face, otherwise your face becomes sunken and older. If you look at 70 plus individuals, healthy 70 plus individuals not taking medications that gains weight, if you look at the average 70 plus individual, there's very little fat in the face, and so there's a lot more hollowness and gauntness in the face. That is what aging is. So if you remove the buccal fat, you are prematurely aging yourself, and you will suffer the consequences of that, because it's not reversible. Now you have to do so much filler. So I do not recommend buccal fat removal. However, if you go to a surgeon who does this predominantly most of the time, that's what they're going to do for you. In my opinion, it is one of the worst facial medical surgical procedures to be performed. It is irreversible, and the problem is that once that fat is gone, you cannot replace that fat. And the only thing you can do is to inject fillers more regularly. But now there's no fat, so the filler is going to do something different. Filler loves to be around fat. Fat supports the filler. Without the fat, the filler becomes boggy and it doesn't really look right. Now, here are some celebrities who have been rumored to have gotten buccal fat procedures. Now, I'm not sure if this is accurate, but we have Miley Cyrus, Amelia Gray, Zoe Kravitz, rumored to have had the surgery done. Listen, these are great looking individuals. My concern isn't now. My concern is 5 years and 10 years from now. When you're younger, you can do anything and you look great. As you become older, you suffer the consequences of doing too many things at a young age. So that's with the Ozempic. Let's look at our model here. Now, we have 3 images of the same individual, left side, and then both sides frontal view. And if you look at that right left side, it's a normal face of a 20 plus individual, and to the right of that, there's a more sunken hollowness below that zygomatic arch, below this cheekbone. However, the mandibular bone is still straight. Yes, this may be just an illustration. There's probably some Photoshop that's done here, but this represents what taking the buccal fat out can create. Obviously, this is a perfect example, and we know it's not always going to be perfect because the buccal fat comes in different shapes, and also if the practitioner is able to take all of that fat out or just partial of that fat, you will have different results. So your results may not necessarily look like this model, which is presenting with a very nice contoured cheek and mandibular jaw line. So this is a wonderful image of an illustration to sell you buccal fat removal. Now let's take our second image, and we're gonna have real life 3 individual personalities that we know. So these individuals, Bella Hadid to the left, Amelia Gray in the middle, and Lea Michele on the right. Again, if they have had buccal fat removal versus Ozempic, I do not know, but I will tell you, when it comes to Bella Hadid, the sunkenness on her cheeks have kind of making her very sunken. I believe this takes away a little bit from some of her sharp beauty, because she also have the under eyes that are a little bit on that hollow side. She's still a very beautiful girl, along with the threading of the eyebrows that's done, this is the type of look that she can portray, but she can also easily reverse this look. Remember, to reverse these looks cost money. So if you're following a celebrity to look a certain way, when you want to reverse that, you're probably spending maybe the same or twice as much as you spent to create that look for yourself. The second is Amelia Gray. These are much sharper angles that Amelia Gray has. If you look at that mandibular angle, it's beautiful, but it's very sharp. If you look at the cheek, it's very sharp and protruding. These two alone can give you that Ozempic or that buccal fat removal appearance. And I believe maybe this is the case for Amelia Gray. I have nothing here telling me definitely that she did that buccal fat removal, and I really kind of don't think she did. I think it's mostly filler, and maybe a thread, maybe. However, the threads on the eyebrows as well gives this look. This look reminds me of Angelina Jolie. Angelina Jolie, let's say 20 years ago, 15 years ago, this was her look. Today, it's the same look with a twist. However, it's the same sharp angles that contributes to a thinner face. When we're doing fillers, we can create full faces or we can create thinner faces. And in this case, I believe with Amelia Gray, we're creating a thinner face. And last is Lea Michele. Lea Michele, again, loved by everyone. I believe she has a play on Broadway. Great face. But Lea Michele started out with a full face, more of a full square versus full rectangular face. And that full face had a lot of fat in it. That was her baby fat. It was her early 20s, bombshell on the stage. And today you can see some small changes occurring in her face. If not done well, I can almost guarantee you, if not done well, Lea Michele may have disastrous results if she's not under the right medical professionals' hands. Why? If you look closely, her nose, her mouth, her chin, her cheeks, it's almost as though they're placed in different ways that doesn't communicate with each other in its totality. Sometimes it's difficult to explain because the face is very complex. And if you don't follow, if the medical practitioner doesn't follow the patient's landmarks, then what happens is we have cheeks that look like they're placed on the face, noses that look like they were overdone, chins that look like they were placed on the face, jaw angles that look like they were just thrown on the lower jaw region. It's imperative that you go to an educated, well-knowledge medical practitioner to have this stuff done when you're looking for major changes on the face. That's it for this episode on Ozempic versus buccal fat removal. It's a wonderful thing that can be done. However, it's irreversible for the buccal fat removal, and many times to reverse it, if you're doing Ozempic and you want a full face after, it may cost you a lot more money for that. But I do know Ozempic is not a very cheap drug to have. I believe it runs around $1,500 to $2,000. It's very high, and reverse it is also very high. Thank you for watching. Don't forget to subscribe to this channel for more important information on beauty and all things beautiful.